So we're going to be talking about dialysis. So you're going to be getting either an AV fistula or an AV graft, and what I need to do is describe to you exactly what the procedure is. Just a little bit of some anatomy. You know, if this is your heart, just two types of blood vessels we need to talk about: arteries and veins. Arteries, which will be in the red, carry blood away from the heart, and veins carry blood back to the heart. One more time: arteries carry blood away from the heart, and veins carry blood back to the heart. Okay, now depending on your vein mapping will determine what type of access you have, whether it's going to be a fistula or a graft. So let me explain to you what a fistula is. If your veins are of good size and your arteries are good size, we will then take the vein and hook it directly up to the artery. So this is what you call a fistula. The other end of the vein is actually tied off. So we take one piece of the vein, tie it directly to the artery, and what happens then is the blood that's coming down the artery will go up the vein, and the other part will go down towards the hand. All right, so that's a fistula. For a graft, if your veins are small and you can't do a fistula, it'll be one of two types of graft. Now, a graft is synthetic, all right? It's man-made. And being man-made and synthetic, it's not like your own body where it's a fistula. These have more problems, right? So you want to have a fistula if you can, but if you can't, then you don't have a choice but to put a graft in. All right, so two types. It's either going to be what they call a straight graft or a loop graft, right? If it's a loop graft, it's going to look like a horseshoe. One end of the graft is going to be tied to the artery. The other end is going to be tied to the vein. So blood that comes down the artery will go up into the graft, and then the other part of the blood is going to go down to the hand. It's going to go around the graft and then up the vein back to the heart in your loop graft. And then for the straight graft, typically these are put in the upper arm, and if down here's your elbow and up here's your shoulder, blood's going to come down the artery, up the graft, through the graft, and up the vein and back to the heart. And the other part of the blood is going to go down towards the hand. When they perform dialysis, they use two needles. Right? The first needle, usually is the one closest to the artery, is going to bring blood to the machine to be cleaned. The other needle is going to bring blood back that's been cleaned. In a loop graft, they may put the one needle here and one needle here. And again, the one closest to the artery is going to bring blood to the machine to be cleaned, and the other needle is going to bring blood back that's clean. For the vein, it'll be just two needles, kind of like a straight graft. So those are the three types of access that you'll be putting in your arm. Depending on your vein map, and again, will determine what you can have. The fistula is always the best way to have it, but if you don't, the graft is the second best. But you should know that the worst of all things is the perm cath, the one they put in your chest. That's the worst. You don't want this, and if you have this, and most of you do, you want this out as fast as possible because it causes problems. So let's talk about why you want the perm cath out, right? Number one, it'll cause clotting of your vein in your chest. And number two, it has a high risk of infection. A lot of people admitted to the ICU in the US are admitted because of perm cath infections, okay? In regards to clotting of the vein, it'll clot up, this perm cath will clot up the veins to your heart, which will then lead to your head being swollen like a balloon and your arms being swollen. And once that happens, your quality of life is miserable. So you definitely want the perm cath out. Talking about the graft versus a fistula, just to know, so you know what you could possibly encounter, is that since it's synthetic, again, this has a higher infection rate than a fistula because the fistula is your own body. You rarely ever react to have an infection with your fistula. So you may get more infections with the graft and more clotting, but much less than a perm cath, much less. So in order of priority, you want the fistula first, the graft definitely second, and the perm cath a distant third. You don't want the perm cath if possible. One last or a couple more complications possible with putting a fistula or graft. As I mentioned, artery carries blood away from the heart, blood with oxygen. Veins carry the blood back. Well, if too much blood goes back up this way, you have too much blood going into the graft and very little going towards the hand, your hand will get very cold and painful and almost paralyzed. You have to let us know that right away, because if you don't, you may lose function of that hand. And if that's the case, there are things we can do to the graft so that less blood flow goes through, or we even have to sometimes tie it off and find another way for you to be dialyzed. So again, bleeding, infection, clotting, and possible stealing from the hand in a graft or even in a fistula. So those are things that you need to be aware about, and after your procedure, always communicate with us if you have any of these problems. And if you do have any of these problems, call us immediately. Sometimes we can see you in the office or go immediately to the emergency room.